Well, there it is. All right. Welcome to today's Project Scope session. We're glad that you could join us today. We are going to be recording today's session, as you just heard. We share that on our Canvas page as well as our YouTube channel. So you are always welcome to go back and review any information. But by joining today's session, you're consenting to be recorded. Again, if you do not know how to change your name or raise your hand, here is some ways to do that. We'd love if you would rename your profile and tell us where you're from, what organization you work with, if you have a specific discipline. It does help our presenters as well as everybody else on the call so we can get to know each other. We do talk about a lot of sensitive information during these echo sessions. So please remember to protect individual privacy. Avoid using first, middle, or last name, any identifiable information. Just helps us make sure that we are not breaking any confidentiality. If you have any questions about individual privacy, please reach out to one of our hub members. They all have an asterisk in front of their name. If you've never joined an echo session, welcome to your first echo session. Echo sessions are really building that network, professional networking, so that you know who to reach out to if you have a question. We will always have a didactic speaker, and then we have a case presentation where we all provide some feedback. It's a great way to learn more information and learn from your colleagues. If you have not done so, please take a minute to turn on your camera. I know it's easy to turn off your camera when we're on Zoom, but it helps participants. It also helps our speakers see smiling faces on that call. And just remember that we're an interactive community. We want to get to know each other even though we're over Zoom. We would love for you to put information or comments into chat. Bailey and Kurt manage the chat, so they will share your comments in there or respond to them. Case narratives are a great way to learn information. So if anybody is ever interested in sharing a case or having your case doing some brainstorming, please reach out to Project Scope at usu.edu. You get information. All of our recommendations are shared on the Canvas page. So if you were in a small breakout group or you wanted to know what was shared with previous ones, you can always go back and look at those. In order to get a credit or a certificate of attendance, we do ask that you fill out those session surveys that Bailey will be dropping in the chat throughout today's session, as well as in an email. That we take that information and share those back with our funders so that we can keep these sessions free of charge. So we appreciate everybody who always fills those out, and just another plug to continue to fill it out. Canvas is where we store all of our information. So if you've not had access to Canvas, you can again reach out and put Canvas on the subject line, and we will get you an invite to our Canvas page. We'd love it if you would follow us on any of our social media. We share information, valuable resources, as well as information about sessions. So I'm going to leave this up here for a minute while I introduce our speaker today, Trisha Reynolds. I'm thrilled that she is joining us today to talk about all of her amazing work that she is doing at the Department of Corrections with incarcerated moms. So I'm going to stop sharing and let Trisha take it away.
Perfect. Hi, everyone. I am so excited to have Janelle's invite to come and talk to you guys today about this population that's often known in the literature as the hidden population, children impacted by incarceration and having incarcerated parents. My hope is that by the end of the presentation, you guys can have some tools and skills to screen for and support children who may be impacted by this, and help them get the additional support that they need. So my name, again, is Trisha Reynolds. I'm a licensed clinical social worker. I work for the state of Utah Department of Corrections. My title is Intergenerational Coordinator, and why my boss created that title, it's a long mouthful, and I often have to explain it, but I like to explain it because really having an incarcerated parent makes you more at risk to become incarcerated yourself and have a host of difficult outcomes. And so the hope of creating my position, which is a brand new position for the department, is to help break that intergenerational pattern and transmission of some of these risk factors. So my background's in child welfare. I worked for DCFS for 18 years before I came here in December of last year. So it's been really fun to kind of bring some of my child welfare framework and thinking to the correctional system. It's often challenging for people in the correctional system to hear my new ideas and my crazy progressive ideas that they're not used to, but it's good. Everybody needs to be pushed and challenged. So I'm here to share just a little bit of information with you guys about what incarceration kind of looks like and how it ends up impacting children that you guys may serve. And then just some of the projects that I'm working on to support this community and make connections with others. So please feel free to ask any questions as we go. I don't mind if you raise your hand or just come off mute and ask a question and have this be an interactive dialogue, or put it in the chat. And maybe, Janelle, if you see something in the chat that I missed, you could let me know. But don't feel like you have to save all your questions for the end. So any questions so far? Okay, you guys can see my PowerPoint, right?
Yeah.
Perfect. Okay. So I want to start with just some information about how many children are impacted by incarceration. I was shocked by these numbers. They're probably larger than you might think. So when we look at a survey of U.S. prisons, 54% of them report being children, parents of minor children. And there's differences by gender. So we know that incarcerated women are attached to a lot more children than incarcerated men are. The women are moms at a higher rate, and they tend to be primary caregivers of more children than the men. And then when we look at data related to children across the country, we know that about 5 million US children have an incarcerated parent. That ends up being 1 in 14 of all children in this country have been impacted by parental incarceration, which is really shocking to me and makes me feel sad and bad that I didn't know this when I was a child welfare worker, because I didn't always maybe give this the credit that was due. And so what do we know about Utah? This data that I shared is nationwide, but what we know about Utah is, well, not a lot, because no one here tracks this information, which is one of the first things that I realized when I came to the department. I was applying for different grants and trying to get some data on how many people here were parents, so I could demonstrate the need to funders. And surprise, we don't ask people if they're parents here at all. So that's one of the projects I'm working on, is better awareness and data collection surrounding parents and families, so we can start to see really what the need is. So the best data that we really have comes from state BRFIS data. Do you guys know the BRFIS? It's like public health. I don't know what it stands for. Public health does a survey about all these different health behaviors and whatnot. And one of the things they measure is ACEs. Having a parent incarcerated is one of the original ACEs in the original ACEs study. And so they have some data from adults in Utah who report that as a child, they were impacted by parental incarceration. So based on that data, we believe that about 1 in 12 children in Utah are impacted by incarceration. So even higher than the national average, which is kind of surprising and good to know. And why have so many children been impacted by incarceration? It's really risen since the 80s, and it correlates with the rise in mass incarceration of females. So since the 80s, across the country, there's been a 600% increase in the number of females that are incarcerated in state prisons. And if you look at Utah, it's actually 1,700% increase, which is out of control. A lot of this comes from changes to like how drug use is now more criminalized than it used to be. And so a lot of the people in the state prisons are here because of addiction or crime stemming from addiction, especially our women. We have a much smaller percentage of women with violent offenses compared to men incarcerated population. Ooh, the chat popped up. Let's see if I can see this chat. Okay, perfect. Jamie's introducing herself. Welcome, Jamie. And one reason why we think that there's more children impacted here than other states maybe is because we have such a high birth rate and such a large family size. So when you incarcerate someone, they're likely attached to more children than maybe another state. So I just think that's super helpful to know that for every 12 children you see, one of them is very likely has been impacted by this. I want to talk quickly about pregnancy in prison because it's really not talked about or known. So about 4% of women nationwide are pregnant at the time of admission to a state prison. For Utah, that's about 15 pregnancies per year on average. So 2,000 babies are born to women in prison. And guess what happens to 90-something% of them? They get separated from their moms. They get to stay in the hospital for a couple days and then they go with family or to DCFS. There are a few states who have prison nurseries, and I'm going to talk more about that in a little bit. Okay, this is the ACEs. I briefly mentioned this. My guess is that all of you working in this profession are very well acquainted with the ACEs study. But if you're not, we know from decades of research that children who experience these types of adverse experiences as children, those are correlated with a host of negative outcomes related to mental health outcomes, physical outcomes. There's a lot of expenses to our public systems when children experience these ACEs. And so really just highlighting that having an incarcerated parent or relative is an ACE. And what's interesting, if you look at the Utah ACE data, is people who endorse that particular ACE tend to have the highest ACE scores of anybody else. So that happens because when you have an incarcerated parent, it's correlated with many other ACEs, likely substance use or mental health issues or domestic violence. And so it's like that complex trauma, and where we see worse outcomes happening with a higher ACE scores, that's our children impacted by incarceration. They have the highest ACE scores. Oh, here we go. So there's a lot of studies about how parental incarceration impacts kids really from the time of birth all the way into adulthood. And this is just kind of a sampling of some of the study outcomes. But we know that children tend to have higher developmental delays, and that's where you all come in. And I want to talk at the end more about how we can have some better collaboration and communication with early intervention services, since we know that this population really needs to be accessing those. We know that these kids often end up being suspended or expelled and even have a lot lower graduation rates, mental health issues. And then this is what always gets me about the ACE studies is the physical health issues like higher cholesterol, more migraines, higher rates of HIV, AIDS, higher rates of obesity and asthma can come from having an incarcerated parent. And then, of course, this is all correlated with poverty, homelessness. It's really cyclical. Imagine leaving the prison and how hard it is to find safe housing for your family or a good paying job when you have felonies on your record. And then that just contributes to sometimes more challenges and child welfare involvement and then more trauma. So this is the cycle we're trying to interrupt. And some studies showed that children of incarcerated parents are up to 6 times more likely to become incarcerated themselves. This graphic is so interesting. The average person in the US has a 40% chance of graduating from college. If your dad was in prison, that drops to 15%. And if your mom was in prison, 2%. And we do know that children of incarcerated moms tend to have a lot worse outcomes compared to children of incarcerated dads. No one's 100% sure why, but I have some theories, but it doesn't matter because no one studied that. Okay. Any questions so far about the data or the scope of this population that we're talking about? Does that surprise you guys to hear those numbers or any of that info? Okay, no surprises. All right. Prison nurseries. Has anyone heard of a prison nursery? Anyone know what a prison nursery is? No. Okay. So a prison nursery exists in 8 states and soon to be 10 because we're going to open one. And Missouri is going to open one. This is where you give birth to your baby and you get to bring your baby back to the prison and raise your baby for 18 to 24 months. So you can form a healthy parent-child attachment with your baby, get some support with how to interact with your baby, have that healthy didactic interaction, support for breastfeeding. Our moms here right now pump and dump their breast milk. So we're trying to create better pathways that babies can have their breast milk if they would like to offer that to their baby. And then really support these moms with reentry with their baby into the community and ensure they have safe and stable housing, income, daycare, transportation, all those things they need to be successful. So here's a map. The green states are the states that currently have prison nurseries. New York State Bedford Hills Correctional Facility is a maximum security prison for women, and they have had a prison nursery for over 100 years. They have really, really strong outcomes. A lot of the studies on prison nurseries have been done at Bedford Hills because the length of their program. Most of the other programs have been around like 10 to 20 years. There haven't been any new ones opening in recent years. Pretty much every other industrialized nation other than the US, and there's like maybe 2 others, allow mothers to stay with their children in prison. And over the past century, there have been like ebbs and flows of this in the US where states have had prison nurseries and then they don't do them. So it's kind of like, it depends on current administration or current things if they have prison nurseries or not.
Trisha,
yeah,
there's a question in the chat about.
Thank you.
From Erica. I don't know if you want to attack that one now or later.
Great question. The criteria for each state's a little bit different, but I can tell you kind of the averages and what we're going to do in Utah. The biggest goal here for us is we don't want to separate moms from babies at the end of the program. So we will base admission into the nursery on the length of the mom's sentence, correct? If the mom has a sentence that will allow her to leave with her baby in that 18 to 24 month time frame, she would be potentially eligible for a bed space. If we have a mom here with a 10-year sentence, we know because other nurseries have studied this and tried this where they've had long time sentences, the moms have the babies with them and then they separate the baby because the mom can't leave. And those babies have had poor outcomes. So we know that we don't want to do that. And so that will be a big criteria for us. And a lot of other states have something like that, like 3 years or less, or just depends on the length of their program. Okay. It's also surprising that women are more likely than men to be incarcerated. Well, it's not that they're more likely to be incarcerated. The overall population of women is a lot smaller than men. In our prison here, 15% of our population is women and 85% is men. It's just that the rate of incarceration for women has really spiked over the past 40 years, while the rates for men have not spiked as drastically. Am I explaining that well? Yes, the opioid epidemic is the #1 contributing factor to this. #1. Nearly every single mom that I work with here has struggled with opiates. Very few are not here for something related to that. Okay, so our nursery is going to be called Chirp. We're trying to come up with a bird logo. That's not our official logo yet. We're working on one. All the nurseries have cute little names. So this is our cute little name. So we only have space for 4 moms and babies. The Department of Corrections moved to a new prison in last July. I think most people know that, but we used to be in Draper and now we're near the airport. And so we've been developing the plans for this prison nursery for the past 6 years. Long before I worked here, people were working on this. And so a special section was built into the designs for the new prison. So I have a little empty section sitting right over there with 4 individual bedrooms for the moms and babies. We talked about the length of stay and a little bit about the criteria. We haven't fleshed out all the criteria yet. We are we're not opening immediately. We have some work we need to do with an advisory board that was created by the legislature in this past legislative session. We were anticipating opening the nursery this past summer until this advisory board was created. And so this advisory board is kind of reviewing some of our plans and giving us some input on some of the criteria and whatnot. So none of this is set in stone, but if we have a really medically needy baby, like a baby who would need regular appointments, we wouldn't be able to accommodate that here. And we want to make sure babies have access to the care they need. So that could be a potential reason that somebody would not use the nursery. Some states just automatically rule out anybody with a violent felony. And we're not going to automatically rule out anyone. We're going to look at each case on a case-by-case basis because these things are really nuanced. And, you know, a sex offense for one person can look very different than a sex offense for another person. And so we're just trying to leave some room for really what's best for that particular case. And then, of course, when we screen women for the nursery, we will have like a multidisciplinary team of staff from our mental health services, medical services, security staff to kind of each weigh in on, you know, how has mom's behavior been in her section or whatever, to make sure we're making the best decision for each baby. There's a lot more information about the prison nursery if you guys are interested in that. It's the thing in my work that people tend to be the most interested in because it's the most maybe shocking if you're like, you're going to have babies in prison. So there's just a ton of positive research about nurseries and some media coverage that we've had on ours. So I linked some hyperlinks here and I will share my PowerPoint with Janelle. I think I already did. So you guys, if you're interested, you can click on these links and read like the article in the Tribune that was about the nursery. But this is the bill that was passed that created the advisory board that we're working with to get the nursery open, some of that stuff. And then we have probably 100 or more volunteers from the community that have helped us with the nursery development up to this point. Before my job was created, there were no staff from the department whose sole job was to work on this. And so we were really reliant on professionals from the community who volunteered their time to, for example, create recommendations for breastfeeding in the nursery. So we have like a neonatologist and developmental pediatricians and lactation specialists and early childhood experts and people from like every state agency that you can imagine has been involved in this. And so I'm working on creating like a mailing list where I can provide better updates to the community members who are invested in this. So if you guys are interested in like getting more regular updates about progress and needs, we're going to be probably asking the community for some donations coming up here because we were not able to get some funding from the legislature that we were hoping to get. So if you want to be in the know about the nursery, let me know and we can stay connected on that. These are some very weird pictures of me. Please ignore me and my boss, but I wanted you to see what the nursery looks like. So the bottom right here is what each individual bedroom will look like. So this is mom's bed, and of course they'll have a mattress, don't worry. And then each room has a crib. And then what you can't see in the picture is like a little changing table and some storage for the moms. And then obviously we don't have all the like little soft supplies in here yet, but we'll have, you know, it'll look softer. We'll have some better flooring and cuter, softer baby stuff all over. I just don't want to set it up yet because I don't want it to get, dirty before we open. But oh, and then the picture on the left is this is the living space. So we have like some couches coming to create kind of a living area on the left, and then on the right there's a little kitchen area where the moms can like prepare food for babies, clean breast pumps or whatever. They have a washer dryer, they have a little outside yard and access to some green space. And we have a lot of the supplies. We're just working on getting like outdoor play equipment and some miscellaneous. See all the diapers in the back there. Questions about the nursery? Yes, I will definitely share my contact information. I'll do it at the end so I don't get distracted. And I think what we're going to do for donations is probably create a page on our UDC website where people can see what we're needing. It's tricky to get items in the prison from a security standpoint. So we won't be able to accept donations from anybody's home. They'll have to be like purchased from a vendor and sent directly to us, because believe it or not, people try to smuggle all kinds of things into this prison. So we don't accept donations from a person, only from a vendor, if that makes sense. Anyway. This is just some of the plans of like the programming that we will have available for the moms and babies when we open the nursery. Yes, they're in a separate unit, kept separate from general population. The sections in the building with other sections of general population, but we're not planning to have them really mixing and mingling. We've talked through different options of like mealtime, if we want to let the moms and babies have their own separate mealtime, or if we want to actually bring food to them. So we're still trying to flesh out some of those things. But the moms will definitely be able to leave the section and go access programming within the prison that they want to participate in. We have educational opportunities here. We have residential substance abuse treatment here. So the moms will be able to do all of that. And we will likely be utilizing a nanny program based on what other nurseries do, where they screen and train other female offenders who are interested in providing temporary childcare. And then the moms could choose from the pool of approved nannies to watch their baby for a couple hours while they go to treatment. So hopefully that answered your question. Some of the other things we'll have in there are parenting classes. I'm trying to get some specialized case managers. Our case managers here that support our women have like caseloads of 100 women and just don't have capacity to add tasks related to like children and families. But we really need to be doing that and supporting the more holistic family unit. So I'm hoping to find some funding to get case managers that would just work on this population and like other parenting types of cases. All of our offenders have access to clinical services, so we're working on improving the way that we screen and support maternal mental health. And then we get all of our prenatal care from the Super Rad Clinic. If you guys know Dr. Smith and Jasmine Charles, Jasmine is the OB provider for all of our women. And so she's such a great partner to support them through their birth and their pregnancy. And then I mentioned that the moms will be able to access all the things we have here, religious services, trying to figure out like if the babies can go to church with the moms and just those kind of little logistical details. Washington is really the nursery that we know the most about because we went and did an on-site tour with them in April and spent a couple days seeing their nursery, talking to the moms in their nursery, talking to the staff, asking them all of our little questions. And they have a cool model where they use a nursery clerk, which is another offender, and she kind of acts as a liaison between the moms and the staff. So we'll probably do that. And then, one big question I get is, can the babies leave? Yes, the babies can leave. They're not in prison. They can leave and go have visits with, if they have a dad that's involved, grandparents, whatever. And then we do have a lot of community agencies that will be like either coming in or providing some sort of support. Since the babies are not incarcerated, they are eligible for all state funding and resources. So like the babies can get Medicaid, TANF. Washington gets TANF for the babies, and then the moms use that to start ordering some of their own baby supplies so they can get used to like how to manage the budgets and choose the right baby things, you know. And let's see, Washington has early Head Start on site. So that's kind of a cool model. And we don't really have space for that, but that's one of the partners that I still need to get with, is figure out how we can get those types of services for our babies. Questions about the nursery? And then I'm going to move on from the nursery because there's lots more to talk about. Okay, so the nursery only impacts 4 moms. And so while it is very exciting, there's a lot of work to be done with all the other parents here. I'm supposed to support the dads too. It's been a lot to like figure out how to support thousands of incarcerated people, but we're going to get there. Oh, you're welcome, Farah. Bye. So I mentioned the data collection. We really need to just understand how many people here are parents, how many children they're attached to. I'm curious where their children live. Do they live with their opposite parents? Do they live more with grandparents? I can tell you anecdotally from talking with the moms, but trying to collect better data surrounding that to inform our priorities and decisions and funding going forward. I've been working really hard on DCFS collaboration. So as you can imagine, when children are involved with child welfare, we know they only have 12 months to reunify with their kids. Sometimes if you're in prison, you can't get your case plan done in that time period and you have your parental rights terminated, which is too bad because sometimes those parents would be doing a great job on their case plan if they weren't here. So I've been screening all the moms that get, every woman that comes to the prison, I screen if she has an open DCFS case, and then immediately contact their DCFS worker and try to keep their case plan going while they're here. So that's been a really new practice and it's been going super well. We've been able to get visitation going between many parents and their DCFS involved children. We've been able to make sure parents can get to their child and family team meetings so they can know what's going on and have input about case plan decisions, and even get them prioritized for some of the programming we have here so they can satisfy their child welfare case plan requirements. So that's one really exciting success, I would say, from the first year working on this. We are starting to explore diversion programs for pregnant and parenting offenders. So many states have diversion programs and they look very different in every state depending on a lot of things. But just as an example, Washington's diversion program is your judge who sentences you to prison can choose from a prison sentence or a special like family probation where you return home and you take up your parenting duties and you get additional support from different community partners. And if you successfully complete your 12-month probation, your prison sentence is you've completed it. They also have like a back-end diversion program where if you are in prison and you're a parent and a primary caregiver, you can apply to leave 12 months early and do that same specialized family probation role, and then return to your parent caregiving duties. So that's some examples and some of the programs we're looking into. Utah is unique. We have what's called indeterminate sentencing here. So you guys have heard like someone gets a 0 to 5 sentence. It's a big range. And so they come here and then they work with the Board of Pardons and Parole, which is a separate independent group. They're not part of corrections. They review cases and they review all the factors relating to the crime and then like progress here. And they determine if you get the 0 or the 5 or wherever in between, if that makes sense. So to do a diversion program, we partner with the department, with the Board of Pardons, and they would have to be on board with whatever diversion program we want to propose. So this is kind of like in the newer phases and not as far along as, say, our plans for the nursery, but something that we're definitely, I would say that's more of a priority than the nursery, because I would rather have babies and their parents in the community than here. So working on what that could look like. Protective factors training. So the family strengthening families protective factors framework, which is ubiquitous in all child abuse and neglect prevention work and child welfare work. There's nothing really, no training like that in corrections. There's not really much training for looking at the whole family or the children involved with the offenders. So I'm working on getting some different sort of training for our like parole agents and our case managers, where they could better understand the whole family. The breastfeeding program I mentioned, we are, again, modeling after other states who have programs where the moms pump and then family members can come pick up the milk and take it to the baby. So I'm hoping to get that finalized this week, because I have a mom giving birth like any day or next week. And the plan is for her to be the first one to get her milk to her baby. So that's going to be really exciting progress. In the past, we've had a bedtime stories program where volunteers from United Way come in and work. They record the offenders reading bedtime stories to their kids, and then they email the videos to their kids. A lot of our programming got stopped with COVID and with our prison move. So I'm meeting with them again this week to get that going. We recently launched a photo program here at the prison. So people can send pictures in, but there's not been a mechanism for offenders to have pictures of themselves sent back out to their family. And that's really important, especially for kids, because, you know, if parents are here for a while and they're like stable and working on sobriety, their looks may really change. And so just the importance of kids being able to see and stay connected with their parents. So how it's working right now is when people come for a visit, they take like a family picture and they get to leave with it. And then the next steps are figuring out how we can do more of the picture taking, like for people who may not have visits or only have video visits or something like that. Doula support. So we have a little bit of support from these amazing doulas in the community who come in and teach a 6-week birth education class to all of our pregnant moms. And I would really, really love to figure out how we can get doulas to be able to provide continuous labor and delivery support for our moms. Currently, when moms go to the hospital, they are not allowed to notify their family that they're leaving the premises because it's a flight risk and a safety risk. They give birth by themselves with 2 officers in the room. It's really sad. And that's how it is in pretty much every other state. There's like one state I could find that allows birthing females to have a family member with her. So my long-term plan is a family member, but that is a very big ask. So doulas is, I think, a lower hanging fruit, and just trying to figure out the funding so we can, you know, we can't ask doulas to volunteer 3 nights of labor. That's a big ask. But if we can find some funding to pay doulas to like meet with moms before they give birth, help them create a birth plan, spend time with them in the hospital, meet with them afterwards to, you know, talk about breastfeeding or whatever. So that's something I'm working on. I saw your face, Janelle, and you know, in some states, women are still shackled, like have their legs handcuffed together when they give birth. So there's a lot of inhumane treatment of women in prison and pregnant women. I saw an article the other day of a woman in another state who gave birth to her baby in her prison cell because staff didn't believe her that she was in labor. These things happen every day. So when I see stuff like that, I'm reminded that despite all of the uphill climbs that I feel like we have here, we are not having any babies born in a prison cell. I can promise you that. And we don't shackle women. We haven't for a long time. We did, like, I don't know, 10 or 20 years ago. But those laws have changed, and there are some of the jails here, the county jails, that we're not over them. There are still varying types of shackling things in place for pregnant women that are probably not ideal. And so I know there's a lawmaker who passed some legislation last year to change that for the county jails and try to improve that. So our women are not restrained when they go to give birth. Improving maternal mental health care. Again, we have mental health services here, but like everyone, we have a critical shortage of therapists in our facility. And so I would like moms to be screened more regularly for depression and anxiety. We know the rates of those are a lot higher in our population, and we screen them a little bit, but probably not at the frequency that we should be. We do have a maternal mental health group for our pregnant and postpartum moms, but just trying to figure out how to better improve that whole system. And then parenting classes. We have evidence-based parenting classes for our men, but not for our women. It's really interesting, having our men and women in the same prison. That's not very common. Most other states have separate female facilities because the needs of female incarcerated populations are extremely different. And so I've noticed here, sometimes the women don't get the same resources because they're just a smaller part of the population, or we'll create policies that maybe work for men. As an example, the assessment tool that we use to assess all of our offenders is normed for men, but not for women. And it doesn't assess for a lot of the criminogenic factors that bring women to prison. So one of the things we're working on is switching to an assessment tool for our female populations that was designed specifically for female populations. So, and trying to get those parenting classes for our mamas. They have very little. I'm trying to remove some barriers to visit. It's just complicated sometimes for families to know how to navigate our visiting process, but I'm running short on time, so I'm going to start to wrap it up. But we do offer video and in-person visits. And so if you guys are working with children of incarcerated parents, I would highly encourage and recommend visitation. A lot of people, I think, are scared of kids coming to prison, but those kids have experienced a lot scarier things. So we make it as child-friendly as we can, and we have that video option. We have games and toys, and we can accommodate special requests for special types of family circumstances. So you can always work with me on those types of things. My big goal is to figure out capacity to support the caregivers for the kids of the parents who are here. I've done a little bit of that on a case-by-case basis, calling a grandma to offer some support, referring people to home visiting or whatever. But my dream is to figure out a very formalized system where every caregiver gets contact and support and resources and, whatever they need. Some states have a toolkit for caregivers of incarcerated parents. So that's the one thing I've had in my mind. And really just time with those caregivers to figure out what it is that they need, right? I don't want to guess what they need. I am trying to guess, but I would love to maybe create an advisory council of caregivers of children and better understand what it is they need. Here are some resources that I put together for those types of caregivers. And I've shared this with various groups, and I'm sharing it with you guys to share with families you serve. But my hope is that just hearing about this and realizing how much this does impact our communities, that you guys can maybe start to ask more questions about that to the families you serve and be aware of some of these resources that they may need. So Grand Families is a great resource for kin that's caring for children of incarcerated parents. They have legal support and parenting groups and all kinds of things. I refer a lot of families to the family support centers. I know when grandparents or whoever get put in the position of caring for children that are not theirs, they need additional support, and maybe they need some respite or, help finding diapers or whatever. Some of these things on here are specific to the incarcerated population. So Sesame Street has created a whole bunch of resources for children of incarcerated parents. Really cute videos with the little puppets that are great to help kids understand what incarceration is. I think they have a phone app too. The US Dream Academy does mentoring with more of like older children, like tween, teen type of age. They'll do mentoring with those kids who have incarcerated parents. I heard about a scholarship that's available for kids who've had parents in prison that can be shared and looked into. And yeah, just some other resources for you guys. And it's printable. So if you click it, it's like a little PDF you can print out and give directly to families. And then of course, I am a resource. I really want to be available to help caregivers navigate visitation, contact with parents, questions, anxieties about coming here, or, you know, when does so-and-so get out of prison? I can help with that. So I will add that. Yes. Why do I not have that on there? This is why I'm sharing. I just made it like 2 weeks ago, so I'm still building it. Duh, Janelle. Okay. Got it.
Trisha, that was such a great, I don't know if you're finished, but I just loved it. Hearing all the things that you are doing for incarcerated moms. And I do think, you know, overall, we as early intervention providers need to have a better understanding of that. I think that I, along with a lot of other people on the call, were surprised with some of those statistics and numbers. Here in Cache County, we do have a county jail. So I wonder how that works, and Kurt being the service director. Yeah.
So there's, I think, 29 county jails or 30, something like that. Wow. And they're all run by the individual county where they're located. They're not run by the state. So the prison is operated by the state. And so our relationship is usually people get arrested, they go to the county jail, they spend some time there while their case is going on. And then they either if they receive a shorter sentence, they'll often get credit for the time they did in the jail, or they'll stay in the jail for a little while. But if they get a longer sentence, that's served in the prison and they transfer here. We do have some state inmates who are placed at county jails. When we get full, or if we know of a jail that has a really good treatment program, we will partner with them and place inmates there. So some of the people in our custody are there, so it's complicated. If you guys have like problems or questions where you run into with jails, I can try to connect with our team that works directly with jails. They often have better relationships and could at least get you in touch with someone who might be able to help. So,
yeah, I mean, I just think that that would be here for Northern Cache County, like a place that we probably should start breaking into as part of our early intervention. So certainly great information. I'm going to see if there's other people that have questions or comments for you. Feel free to just unmute yourself or raise your hand and I'll call on you.
Trisha, my name is Natalie Allen, and I'm a hub member on this team, but I also have a son who is incarcerated. And I want to give a big thank you to the photo program that's recently been instituted. And I know I don't have a mother in there, but my son is a father. And everything you said speaks to my heart. And thank you for your efforts.
Yeah. Are you involved with UPenn?
I sure am. I recently toured the nursery. I work for Department of Health and Human Services, and I'm picking up some shifts there in medical. So I actually visited your nursery. So yeah, it was empty, of course, but I got to see it. Yeah,
full of Amazon boxes. It'll look good one day. UPenn is great. It's the Utah Prisoner Advocacy Network, and they work really hard to support family members who have incarcerated people. And they do so much advocacy. They work directly with our administration to share what they're hearing from incarcerated people and arguing for improvements. They were really integral in getting the photo program to the finish line. So I'm grateful to UPenn. I went to lunch with Molly and one of the moms, Evelyn, who is from UPenn, just to kind of connect on this type of work. And so I'm grateful for family members who are involved and engaged.
Yeah, UPenn is truly my hero. So yeah, absolutely.
Other questions?
Always that lovely awkward pause on Zoom waiting for that. Trisha, I appreciate you again so much for sharing with us. Everybody will get a copy of your PowerPoint, and it will also be on Canvas. So if anybody has any other questions or comments, Trisha has put her contact information into the chat, but it is on that Canvas page as well. So I'm going to thank Trisha. I know she has a meeting that she's jumping off to, and I am going to invite Michelle and her group to present our case. So Bailey, if you want to share your screen. Of course, now you shared your screen and I can't find them to spotlight for everybody. Okay, so Michelle and your group, you guys are up.
Okay, great. Can you still hear me?
Yes.
Okay.
Yeah. We want to go to the first slide?
Yeah.
Okay. Yeah. So we're here in Carbon County, and Michelle is a grandmother who is raising her grandchild. She is his primary caregiver, and we love Ezreal. You may hear him in the background. He may even run in here, and he's a dolly. I'm going to let Michelle tell us about Ezreal.
So he was born basically on the side of the road with a lot of like health issues. Shall I go into that now?
Yeah, or followed, however. Yep.
Okay, so it was cold and he did not get oxygen right at first. It was quite some time before they got to an ambulance into the hospital. At birth, a lot of his organs were not working, and had some serious issues with sugar problems. He was on full oxygen, and they did give him a brain MRI or scan, and they seen that he had some brain damage. It was not at the time significant enough to diagnose him with cerebral palsy, but since then he has got that diagnosis along with autism.
He's been to a lot of specialists and a lot of doctors, and so Michelle has to travel from Price to Primary Children's or the Wasatch Front to have his needs met. Sometimes she has a good connection with a medical provider, and sometimes, quite frankly, she's been dismissed. Her concerns. Sometimes she's seen a provider for like 5 minutes and just been dismissed. And so it's been really hard to try to get his medical needs met. He was on early intervention from 0 to 3. He transferred over to Part B preschools. He goes to a self-contained school now. He has been on the Parents as Teachers program, with the Office of the Home Visiting here, and they are still involved. His nurse Amy is here, and she knows Ezreal quite well. And we've just really worked hard to help meet Ezreal's needs. We could probably go to the next slide, please. Mostly, initially, I guess a lot of it was finding out exactly what his medical problems were going to be. They thought he was going to be blind. I think they even thought there might be some hearing impairment. He just was a real fragile baby. He also is a neonatal abstinence baby. Mom, we believe, or I think she had told us that she had used within 6 hours of delivery. So he didn't have any care before prenatal care. His birth was traumatic. And then because of our area and limitations, it was really hard to focus on what his medical conditions were and what they were going to be. We do feel that his medical needs are sort of stabilized, but it's almost as if we get one thing stabilized, another thing pops up. For example, he now has to go up and have a cardiology appointment, and kidney appointments are coming up. And we can go to the next slide also. And I think if this needs to be shared with the group for them to go back through, we can do that too. Behavior is a big one, and I think we could let Grandma, talk about that.
Yeah, on behavior, it does definitely seem to go back and forth, but he has got some extreme OCD tendencies, which of course then lead to additional fits. He has fits anyway. Some are quite severe, some last for 30 minutes or more. Screaming, kicking, throwing himself. It has in the past limited, and sometimes in the present limited us to going out in public. We've tried a couple of medications for the ADHD and they did not work. So they are now trying a different one, but due to his age, those are the only 3 available right now. And he is medicated for his sugars, but the medication are causing his kidneys to start in failure. And so we have to get labs quite frequently. And now we also have to go start seeing a cardiologist every couple months, make sure he doesn't have a pulmonary hypertension from the medication. We've tried for 9 months to get his genetic test done so that they can better see like what's causing the hyperinsulinism and hypoglycemia. But that still isn't scheduled. He does do ABA therapy daily, qualified for 4 hours a day, 5 days a week. They work, heavily on, I guess, some self-soothing techniques, but he struggles with that. And I've tried to put him in 4 daycares and they've sent him home, one within 10 minutes after leaving him. I can't find a daycare that will take him. I've tried a couple of babysitters, but I finally found one that will work, but it's extremely expensive. And he has been sent home from preschool a couple of times due to his behavior. And he's also a kid that has no knowledge of outside dangers, vehicles, and he also elopes quite often.
The next slide.
The next slide, please.
That one's a little small.
Let's see. So basically, I've applied for DSPD, I believe,
2 years ago.
About 2 years ago.
2 years.
He's still on the waiting list. Through seems like hundreds of phone calls trying to find some sort of respite care, because I am his main caregiver for the first 2 years. There wasn't a day I didn't have him. He averaged about 4 hours of sleep a night. And I could not find respite care, could not find daycare, could not find babysitters. No one would take him ever. So as you can imagine, I was extremely exhausted, and I still am. I still cannot find those things. I do have kind of a emergency babysitter on hand because my mom has fallen ill, and I'm trying to take care of her as well. He does his life skills, and he's global. He has global development delays, and his life skills are quite delayed. So he still needs like help eating with silverware and dressing and undressing, getting ready for school. His barriers are the diagnoses of autism, cerebral palsy, and hypoglycemia. The medication is for his hyperinsulinism. It is a huge, I mean, it keeps him okay, but we have had, I had to have him hospitalized because of his sugars, but our hospital down here won't take him. So basically we go to it and then they ship us up north to Utah Valley or Primary Children's every single time he has low sugars. So it's a really big problem that in its own self. The ER doctors has really basically told me, I don't know nothing about that, so I can't help you. So, we do have like a, division of family services that will take him on emergencies, but they are limited. If they have other kids, they cannot. And it's also limited to like literal emergencies. If it's, I have to have like a doctor's appointment or something come up that, and it has to be scheduled 24 hours in advance. So that's kind of not it is an option, but very limited. I am very, very, very like tired, and I have asked and begged for like respite care for, it seems like this whole time. And that's really my main concern because I cannot care for him if I'm so exhausted I can't even think. Anyway, back to his behaviors. He does get overstimulated extremely easy. He's got sensory issues. He's been known to have like 4 to 5 fits in a day. Some are very, very long fits. He throws temper tantrums because he's typical 3-4-year-old. And I kind of think that's all.
So Michelle is the main caregiver for Israel and also her mother. So she's the only child here. So she's trying to balance these two things. He did get the diagnosis of autism through the University of Utah, and they sent her a list of resources. Every one of those resources was up in the Wasatch Front. So we're very limited here. She probably, when she got that diagnosis, made multiple calls a day just trying to figure out where to go next, and everywhere was a dead end for her.
Yeah, she's met with my coworkers at ISP. We've staffed her in our ISP meetings. We just really, if there are any ways to move up the DSPD list or any grant or options or anything that you guys know about that we don't know about, we're really worried. One, if Michelle's mother has a medical emergency and Michelle has to take her up north, that's going to be a problem. Traveling is hard on Israel too. So even in the car to go to an appointment, the pressure and just the uncomfortableness of being confined is hard for him. And so we are just looking for any options, anything that you guys know about, we would be happy to share and pursue. Sorry, we forgot about saying move slides, apparently. Currently for preschool, in Carbon School District, Part B preschools, if they are 3-year-olds, they go 2 days a week for about 2.5 hours each day. And then if they are 4-year-olds, if they go to the self-contained school, they do get to go 4 days a week. If they go to other schools within the school district, they go 3 days a week, about 2.5 hours a day. And then once he gets to start kindergarten, he should be allowed to go full day, but we are worried about and anticipating that they might ask him to be on a reduced hour schedule.
Okay, group, is there any other questions that you might have before we do 2 breakout groups to answer some of these questions. You guys did a great job of it, sharing everything with your cute little one, and it does sound like there are a lot of things kind of going on with it.
They are lovely. We love this family.
Well, you do have some great support too. So we're going to do 2 breakout groups. Tiffany and Lisa, you will be leading one. Kurt, you'll be leading the second one. And we'll just go through and answer all of those questions. I sent you all an email with the prompts and questions on there. So Bailey, if you want to go ahead and divide the groups up or start those breakout rooms.
Those are open, so you should see an invitation to join, and if you don't, let me know.
Welcome back, everybody. Kurt, you came on mute already. Did you already have one idea you wanted to share?
Well, I was actually going to call on Cindy Jones. There's a respite down in Springville, Spanish Fork with Kids on the Move that Joe talked about. But Cindy had some interesting stuff. Maybe if Cindy, you want to take a quick second and just let us know about that.
Well, I want to reach out to Four Corners Mental Health, because down here in St. George, they probably have 80 of the BiTAP kits like what we've created, and they use them for all ages. And so I feel like we can get a couple of those kits to you pretty easy, Michelle. And so I will definitely do that outreach. And so all it's being used in schools and preschools and everywhere, but it's just a resource. You can hold the tappers or you can wear them, and this back and forth tapping, just if this is your brain and this is the front part and this is the amygdala, it just easily calms that down. And so I would love to see how Israel does with them, but I'd also love, Michelle, for you to have some, just because you're under chronic stress, almost like a first responder. So I'm happy to do whatever work I can and stay in touch with you. And I know the director of Four Corners Mental Health, and she used to work down here. So I will do that work for you and stay in touch with you and teach you how to use them. I'd be happy to.
Okay, thank you.
Thank you. And Israel is on Medicaid, and since they are the mental health Medicaid provider, that might actually really work well. So thank you.
Yes.
Fantastic. Does anybody else have one idea that they would want to share? Tiffany, from your group, looks like you came unmuted.
Yeah, really quick, we had actually a couple of thoughts. First of all, school is absolutely, in our opinion, vital to get him in and to be there. And sometimes, even if it's hard, you have to be your own advocate. Last year, I took in every documentation I was given for my son, all of his testing, all of his assessments. And I set him down on the table and I told him, I said, you have to do this. You have to, it's the law. They have to provide services for your grandson. That's how public schools work. And you have to be that person sometimes to just say, do it. And this is how we're going to do it. And that's something that I would push really hard. The other thought too is that talking about that caregiver burnout, I don't know if you're married or not, but if you could even start small, say 10 minutes, you go sit on the porch in just silence, or 10 minutes and you go in your room and you read a book for a few minutes. For me, it was doing my nails. I like doing my nails, but I never had time. So I told my husband, I said, I'm going downstairs in the basement and I'm locking the door and I'm doing my nails. And that's how it is. And sometimes I didn't even do my nails. Sometimes I sat and did a puzzle. You know, it's just that you have to start small, but you have to give yourself that amount of time, even if it's a little amount of time. Now, that's hard. Circumstances are hard, and that may not always happen. But I think that if you could find that little bit of time during the day, it would ease some of that stress.
Thank you.
Yeah. Well, if both groups will send all of those resources to Bailey Michelle, we will compile all of that information that was shared in those groups. And I know Bailey and I even had our own little breakout session in here with the two of us that we were trying to find some resources and some ideas. So she'll compile all of those and share those out with you, as well as we'll put those for everybody on our Canvas page. I appreciate, Michelle, you joining and sharing your information with us. It's always great to hear from a person who is living it day to day and knows all of those things. So, but it's not always the easiest. So I appreciate you doing that. Our next session will be in October. I jumped like a whole month. Where did October already go? Sorry. It will be October. So October 11th at noon is when our next session will be. Thank you, everybody, for joining us today, and have a good rest of your day.
Thank you.
Thank you.
Thanks.